The following exercise program is for demonstration purposes only. It is not intended to serve as an exercise program for you. Please follow the advice of your physician or physical therapist for an appropriate exercise program. Indications for a total shoulder replacement include progressive pain, decreased mobility, and lack of use of the involved arm. You may experience difficulties with your activities of daily living, including reaching behind your back, reaching out to the side for dressing, and reaching over your head to take a dish out of the cupboard. Sometimes you may have difficulty sleeping on the involved side. You may also experience a sensation of catching or grinding in the shoulder, and a pain or discomfort along the joint line. Initially after surgery, you will be instructed to wear a sling to immobilize the arm and protect the surgical site. A sling is usually worn for about 6 weeks, depending on your surgeon instructions. You are to wear the sling at all times, except when performing your exercises. To wear the sling, your elbow should be sitting in the back of the sling, and your hand is slightly higher than the elbow. There is a strap that is securely fastened around your neck for comfort. To sleep, you can place a pillow under the upper part of your arm for support while lying on your back to avoid any strain on your surgery. To prevent stiffness from developing after your surgery in your shoulder blade, your physical therapist may perform gentle movements of the shoulder blade. These movements include moving the shoulder blade forward, backward, up, and down. It is important to restore the flexibility in the shoulder during this time. Your physical therapist will perform passive range of motion of your shoulder to regain some flexibility. Gently, your physical therapist will move your arm up and down to your tolerance. To prevent your wrist and hand from becoming stiff after your shoulder surgery, your physical therapist may have you perform some exercises of your wrist and hand. Bend your wrist up and down. Turn your palm up and down. And make a fist and open. To prevent your elbow from becoming stiff after your shoulder surgery, your physical therapist may have you perform some gentle exercises of your elbow. With a small towel roll placed under your upper arm for support, your hand can slide along your body, straightening your elbow, then bending your elbow, and returning to the starting position. To prevent stiffness in your shoulder after your shoulder surgery, your physical therapist may have you perform exercises using a cane. With your upper arm supported on a small towel roll, you will hold on to the cane using both hands and gently lift your arms up and over your head. Then slowly return to the starting position. To prevent your shoulder from becoming stiff after your surgery, your physical therapist may have you perform some exercises using a cane. With your upper arm supported on a small towel roll for comfort, hold on to the end of the cane with your weak arm, and your strong arm holds the opposite side of the cane. Most of the work is being done by your strong arm as you rotate your weak arm out to the side, keeping your elbow close to your body. Then return back to the starting position.